Gout is a form of arthritis characterized by sudden, intense joint pain, often affecting the feet and ankles. For swimmers, experiencing a gout flare-up can present unique challenges. The repetitive movements and pressure applied during swimming may exacerbate joint discomfort, increasing the risk of injury or prolonged pain. Additionally, the cool temperature of pool water can sometimes mask the severity of inflammation, making it harder to recognize when rest is needed. Understanding the relationship between gout flare-ups and swimming is essential for managing symptoms and preventing complications. By being aware of these risks, swimmers can make informed decisions about their activity levels during a flare-up. Gout is a form of arthritis that primarily targets the joints, causing sudden and intense pain, swelling, and redness. This condition arises when uric acid builds up in the bloodstream, forming sharp crystals that deposit in the joints, most often affecting the big toe, ankles, and knees. The inflammation and discomfort can limit joint movement, making everyday activities more challenging. Muscles surrounding the affected joints may become stiff or weakened due to reduced mobility and ongoing pain. During physical activity, these changes can increase the risk of muscle cramps, as the body struggles to compensate for restricted joint function. Additionally, dehydration and certain medications used to manage gout may further contribute to cramping. Understanding these effects highlights the importance of careful management and gradual return to activity for those living with gout. A lesser-known risk for swimmers with gout is the potential for a sudden flare-up while in the water, particularly in deep areas. Gout attacks can cause intense joint pain and stiffness, often affecting the feet, ankles, or knees. When this occurs unexpectedly during swimming, it can severely limit mobility and make it difficult to stay afloat or reach safety. The cold temperature of water may also act as a trigger, increasing the likelihood of a flare. Understanding this hidden danger is crucial for those with gout, as it emphasizes the importance of caution and preparedness when swimming, especially in deeper environments. Muscle cramps while swimming often begin with a sudden, sharp pain, usually in the calf, foot, or thigh. Swimmers may notice the affected muscle tightening or hardening, making it difficult to move or continue swimming. These cramps can range from mild discomfort to intense pain that forces a person to stop and seek relief. Warning signs include tingling, twitching, or a feeling of muscle fatigue just before the cramp sets in. In some cases, muscle cramps during swimming may be linked to underlying conditions such as gout. Gout is a form of arthritis caused by excess uric acid in the blood, which can lead to joint inflammation and increase the risk of muscle cramps. Recognizing these symptoms early is important for safety and for addressing any potential underlying health concerns. If you experience a cramp while in the water, it's important to act quickly and calmly. First, stop all vigorous movements and focus on floating to keep your head above water. Stretch the affected calf muscle by extending your leg and gently pulling your toes upward. Use your hand to press and massage along the muscle line to help relieve the tension. Maintain steady, controlled breathing to stay relaxed and prevent panic. Once the cramp begins to ease, move sideways toward the edge of the pool, using slow and deliberate motions to avoid triggering another cramp. To help prevent cramps and manage gout flare-ups before swimming, it's important to take a few proactive steps. Begin by staying well hydrated, as dehydration can increase the risk of muscle cramps and may trigger gout symptoms. Incorporate gentle warm-up exercises and stretching into your routine to prepare your muscles and joints for activity. If you are prescribed medication for gout, ensure you take it as directed and consult your healthcare provider about timing it around your swim. Avoid swimming immediately after a heavy meal, as this can also contribute to cramping. By following these guidelines, you can enjoy a safer and more comfortable swimming experience. Being prepared is essential when swimming with gout. Understanding your physical limitations and recognizing early signs of discomfort can make a significant difference in your safety. Knowing the proper rescue steps ensures that you can respond quickly and effectively if an emergency arises. By staying informed and vigilant, you reduce the risks associated with swimming and help protect both yourself and those around you. Ultimately, preparation and knowledge are key to enjoying the water safely, even with the challenges that gout may present.